Hi, do you know what is lupus disease? Today is May 10, which is a Lupus Awareness Day. So I want you all to be aware of the symptoms that someone might be having, and then you can get yourself tested. It is a disease where there is some skin manifestation and some organ involvement. The first symptom is photosensitivity. That is when the patient goes out in the sun, they experience redness and burning over the face, over the scalp, or on the hands, whatever is exposed to sun. The second symptom is malar rash, where there is redness over the cheek area of the face and as well as on the nose, and it is because of this pattern it is also called butterfly rash. Third symptom that patient has is hair loss. It is like the patient experience suddenly they are losing a lot of hair, and then it could be also a development of certain type of hair which is called lupus hair as well. The patient can have fever and which you don't know the cause. There is no infection. Patient can have joint pain or joint swelling. Also, patient can present with mouth ulcers or mouth sores, and whenever they're eating something, they feel that there is burning. And the next symptom is Raynaud's. Whenever the patient washes their hands in cold water, it turns blue colored, and when only women gets normal. It can also be, it happens normally as well, but in the patient who has other features of the disease along with this, then there is a high chances of them having lupus. Also other organs as well, so it can involve your liver, it can involve kidney, you can have some lung problem, neurological problems, you can have headaches, seizures. So these are other things that you should look for. So if you have a suspicion, if you think that you might be experiencing certain symptoms, then it's always better to get yourself tested. So we perform an ANA test, which is an anti-nuclear antibody test, which actually determines if you have an antibody for that disease or not. And again, it's normal in 5% of the people, but if along with the other symptoms, then there are again high chances that you might be having that. I see that it is always better to know what you have early on rather than facing complications later. So consult your dermatologist, consult your hematologist, and just get your basic investigations done. It is always better to be aware, better to know, so that we can start early treatment. On the patient who has XND, then there are certain triggers. They have the disease and they are well controlled on drugs, but sometimes the other factors, certain kinds of infection like recently COVID, or if you get any vaccination done, or if you take any new medicines, or even in pregnancy, or even stress, that can increase your symptoms. So look out for the triggers if you already have lupus, and it is an autoimmune disease and it runs in the family. So if your parents, they have rheumatoid arthritis, Sjogren's, scleroderma, these are some connective tissue diseases. And so if you have a family history and you have these symptoms, it is always again better to get yourself tested. I really hope this video helped. If you have any doubts, you can always contact me. I don't mean to scare you, but I really want you to be aware. And it is okay, it turns out to be positive, or if you have that disease, it's fine. You can live a normal life. It's just that you will have to take care of yourself and just look out for you and your family.